Dear students, welcome back. In the previous session, we have discussed about tibiofemoral alignment and also the weight-bearing forces, isn't it? Now, in this session, we are going to discuss about this menisci. The relative tibiofemoral incongruence is improved by the addition of medial and lateral menisci, which act to convert the convex tibial plateau into concavities for the femoral condyles. Okay. In addition to enhancing joint congruence, these accessory joint structures, so here you can find the menisci here in between these two. So one is the medial meniscus and another one is the lateral meniscus. These accessory joint structures play an important role in distributing weight-bearing forces, in reducing friction between the tibia and femur, and in serving as shock absorbers. I have already mentioned the function of this menisci in the previous session, but in this session we are going to discuss about this structure of menisci and also the attachments of menisci to the tibia and to other ligaments, and what is the role of the menisci. Now we will discuss. Okay. Normally, the arrangement of meniscal fibers allows axial loads to be depressed in a radial direction. So, for example, if the weight is putting like this, so the weight is not transmitting like this, so it will spread to the radial direction, like the same way as we have seen in the intervertebral discs. Okay, dispersed in the radial direction, thereby reducing wear on the hyaline articular cartilage. Okay, now we will discuss about the structure of this menisci. There are two asymmetric fibrocartilaginous joint discs called menisci, which are located on the tibial condyles. The medial meniscus, so here the medial meniscus is semicircle, whereas the lateral meniscus is 4/5 of a ring. So it is almost appears as a ring, but 4/5 of a ring. Both menisci are open. So this menisci are open towards the intercondylar area. Okay, and these menisci are thick at periphery, so this becomes thick at the periphery. At the center it is very thin. Okay, forming concavities into which the respective femoral condyles can sit. The wedge-shaped menisci increases the radius of curvature of the tibial condyles. So this wedge shape increases the radius of the curvature of tibial condyles, and therefore what happens? So the radius of the curvature increases, then the joint congruence also increases. Okay, by increasing congruence, so that means the articular contact is also increased. Okay, the menisci also plays an important part in distributing weight bearing forces in reducing friction between joint segments. Each meniscus has multiple attachments to surrounding structures, and some are common for both the medial meniscus and the lateral meniscus, and some are very much unique to each other. Okay, so this medial meniscus and lateral meniscus will have some attachments, common attachments, and also these two will have separate attachments which are not common to each other. Now we will see the attachments. Before we'll move on to the meniscal attachment, So if you see the menisci, okay, we have seen the shape, isn't it? So here, lying within the tibiofemoral joint, the menisci are located on the top of the tibial condyles, covering one half to 2/3 of the articular cartilage of the tibial plateau. Both menisci are open at the intercondylar tubercles, which are also thick peripherally and thin centrally. The lateral meniscus covers a greater percentage of the smaller lateral tibial surface. This is very, very important. So on the lateral side, this menisci, the lateral menisci, will cover more percentage on the lateral tibial surface. Okay, and when compared to the medial meniscus, as a result of its larger exposed surface, the medial condyle is more susceptible to injury from the relatively greater compressive loads that pass through the medial condyle during routine daily activities. And compressive forces in the knee may reach 1 to 2 times body weight during gait and stair climbing, and 3 to 4 times body weight during running, with the menisci assuming 50% to 70% of this imposed load. These loads, however, can be influenced by the presence of frontal plane malalignment. The greater degree of genu varum, so the greater degree of genu varum, for instance, there is the greater compression on the medial meniscus is seen. Okay, this is some of the weight transmission or compressive forces transmitted in between the medial as well as the lateral meniscus. Okay, now we will move on to the attachments of the menisci. Yes, so we will move on to the attachments of the menisci. So the meniscal motion on the tibia is limited by multiple attachments to surrounding structures. So that means because of all these structures, the menisci will not slip in between this femoral condyle as well as the tibial condyle. Okay. And some structures are common to both the menisci and some are unique to each. Okay, the medial meniscus has greater ligamentous and capsular restraints, limiting translation to a greater extent than is true for the lateral meniscus. The relative lack of mobility of medial meniscus may contribute to its greater incidence of injury. So the medial side will have greater attachments than the lateral. Okay, if you see the common attachments, okay, the open ends, so I have told here the open ends of the, this one is medial meniscus and this one is lateral meniscus. Okay, so the open ends of the menisci, so centrally it is thin, okay, and peripherally it is thick. The open ends of the menisci are called horns and are attached to their respective tibial intercondyles. So here a ligament is there. If you remove this, we can find the intertubercle or intercondylar tubercles. Okay, so there are number of common connections to these two menisci to the knee joint capsule. Okay, each is connected around its periphery to the tibial condyle by the coronary ligaments. Coronary ligaments. So normally these coronary ligaments or the ligaments which reinforce the joint capsule. Okay. And these coronary ligaments which are composed of fibers from the knee joint capsule also. Okay. So this is the common attachment for both the medial and a lateral, which is attaching with the joint capsule with the top of this coronary ligaments. And both menisci are also attached directly or indirectly to the patella. Actually, the patella is present here. Okay, via so-called patellomeniscal. So patellomeniscal. So from the patella to the meniscal, there is an attachment. It may be directly or indirectly, and also patellotibial ligaments. So these two are anterior capsular thickenings. Okay, the anterior horns of this menisci, both the menisci, the anterior horns of this menisci are joined to each other by a transverse ligament. So this is the transverse ligament. These two horns are joined by transverse ligament, which may be connected to patella. So this one is also connected to the patella via the joint capsule. Okay. So these are all the common attachments. Now we will see the unique attachments of medial and lateral menisci. So the lateral meniscus, in addition to the connections it shares with the medial meniscus, is attached to the posterior cruciate ligament. Here you can see this one is the posterior cruciate ligament. This one is posterior cruciate ligament. This one is attached to the medial meniscus. Okay, and popliteus muscle, and it is also attached to the popliteus muscle, normally which is present on the posterior aspect, and this medial collateral ligament is attached to the popliteus muscle here, and also it is attached to the posterior capsule. So the joint capsule, posterior capsule via again the coronary ligaments, and it also attached to the posterior meniscofemoral ligaments. Posterior, here you can find this posterior meniscofemoral ligament. Okay, so this one, the medial menisci is attached to the posterior cruciate ligament and also the popliteus muscle, and it is also attached to the posterior cruciate ligament, posterior capsule via coronary ligaments, and it is also attached to the posterior meniscofemoral ligament. Okay, this posterior meniscofemoral ligaments which attach to the medial femoral condyle, and also some fibers from the anterior cruciate ligament may also join the anterior and posterior horns. This one, so this one also joins the anterior and posterior horns. Okay, if you see, all these connections are here are very strong. The connections of the lateral meniscus are considered to be fairly loose, leaving the lateral menisci a fair amount of mobility on the lateral tibial condyle. So now the medial meniscus is also attached to the medial collateral ligament, okay, and also the semimembranosus muscle through its capsular attachments. the medial meniscus is more firmly attached and less movable on the tibial condyle than the lateral meniscus. Its lack of mobility may be one of the several reasons why the medial meniscus is torn more frequently than the lateral meniscus. Okay. Now we will see on the lateral ligament. So all the same type of connections is also present with the lateral menisci, but it is not attached with that of lateral collateral ligament. Okay, so these are all the attachments of the medial meniscus, and if you see the lateral meniscus, it is attached to the posterior meniscofemoral ligament. So this lateral one is also attached to the posterior meniscofemoral ligament, and also posterior cruciate ligament. It is also attached to the posterior cruciate ligament, and it is also attached to the anterior cruciate ligament and popliteus muscle on the lateral aspect. Okay, these are all the attachments of the menisci. Now we will move on to the role of menisci. Okay, here we can see the role of menisci. The strong attachments of the menisci prevent them from being squeezed out during compression of the tibiofemoral joint, allowing for greater contact between the menisci and the femur. If the femoral condyle sat directly on the relatively flat tibial plateau, there would be a small contact area between the bony surface. So with this addition of this menisci, the contact area at the tibiofemoral joint is increased and joint stress is reduced. Okay, after the removal of a meniscus, a contact area in the tibiofemoral joint is decreased, which increases joint stress and may lead to damage of the articular cartilage. Okay, so here if you can see, this one is the femoral condyle and this is the tibial condyle. Here no meniscus is present. So if you can see, the contact forces are very much less here. And if you can see this in this B, we have the menisci, and if the femoral condyle sits on this menisci, here the contact forces increases, and also the congruence, joint congruence is also increases, and the stress between the blocks is reduced in the case of presence of menisci, and here the stress is increased because of this limited contact. Okay, if you see the meniscal nutrition and innervation, the location of the meniscal lesion along with the age and health of the patient, which influences the options available after injury because of the capacity of the meniscus to heal. Okay, and this menisci, during the first year of life, blood vessels are contained throughout the meniscal body. Once weight bearing is initiated, the vascularity begins to diminish until only the outer 25% to 33% is vascularized by capillaries from the joint capsule and the synovial membrane. After 50 years of age, only the periphery of the meniscal body is vascularized. Therefore, the peripheral portion obtains its nutrition through blood vessels. but the central portion must rely on the diffusion of the synovial fluid. The process of fluid diffusion to support nutrition requires intermittent loading of the meniscus by either weight bearing or muscular contractions. This thing is very, very important after immobilization. So why this mobilization will helps to heal the joint and also increased the range of mobility. So this is the main reason. After immobilization, we have to mobilize the joint as early as possible. Okay. So this is all about the vascular supply. If you see the nerve supply, the horns of the menisci and the peripheral vascular portions of the meniscal bodies are well innervated with nerve endings called as nociceptors and three different mechanoreceptors that is called as Ruffini corpuscles, Pacinian corpuscles and Golgi tendon organs. The presence of nociceptors in the meniscus is the reason for the persons who can feel the pain, okay, after any meniscal tear. Okay, and also proprioceptive deficits may potentially occur after meniscal injury. As a result, the mechanoreceptors within the meniscus got injured. Okay, this is all about the meniscal nutrition as well as innervation. In the next session, we are going to discuss about the joint capsule. Thank you.